Dr. Bejar, how does my genetic mutation permit personalized treatment decision?
This is an excellent question. All of MDS therapy is truly personalized to the patient in front of us. The major way that mutations help us do this is actually not by helping us select a particular therapy, but by determining the patient's risk overall. So you could imagine that a person who has lower risk disease that is likely to be controlled either with simple measures or a disease that could simply be observed over time doesn't need very aggressive therapy. However, a patient who has more advanced disease that is more likely to develop acute leukemia might benefit from therapy that is a little bit more intense and more designed to get an immediate effect. So the first thing that we do with mutations and other clinical factors is determine what a patient's risk is, and based on their risk, we often select the types of therapies that could help individuals. That said, there are certain abnormalities, either chromosomal abnormalities or genetic mutations, that do help us select a particular therapy for patients. So for example, a lower risk MDS patient who has a chromosomal deletion 5q, where part of chromosome 5 is missing, these patients are very likely to respond to lenalidomide so long as they don't have multiple other chromosomal abnormalities at the same time. Those patients might have a greater depth of response and greater duration of response, so we certainly want to reach for that medication when that abnormality is present. More rarely, we can find genetic mutations that predict response to particular agents. For example, mutations in the genes IDH1 or IDH2 each have specific drugs that are designed to target them specifically, although they're only present in about 5 or 7% of patients with MDS. In summary, the most important thing that we do when we personalize therapy for MDS is determine what a patient's risk is and what diseases they are likely to tolerate or be most effective in them. And that is truly helped by understanding the mutational profile that helps us make a more accurate risk assessment in the first place.